Metro Detroit, it's only been 3 months since the peak of COVID-19 cases devastated our community.
And today, a new study from Henry Ford Hospital looks at who was most severely affected. Dr. Frank McGeorge here with the results. Frank?
Yeah, Devin and Kimberly, the study was published in the Journal of the American Medical Association, and it looked at the characteristics of all 477 patients seen with COVID-19 in the Henry Ford Health System during the roughly 3 weeks between March 9th and March 27th, just as the peak in Michigan was beginning. On March 10th, the state of Michigan confirmed its first 2 cases of COVID-19. The first 2 reported cases in the Henry Ford Health System occurred a day later on March 11th. Cases quickly climbed as the first wave of infections hit. This new report gives an overview of the situation we dealt with. 77% of patients required hospitalization. 40% required the intensive care unit, of which 80% were on a ventilator. Overall, 16% of COVID-19 patients died within 30 days of being seen. The average age of the patients was 58 years old, and being over age 60 distinctly increased the need for hospitalization and risk of death. Although the proportion of men and women diagnosed with COVID-19 were the same, men were 3 times more likely to require a ventilator and were also more likely to die. 77% of the patients treated during the study time were African American. Now, as far as medical conditions that predisposed to developing more severe illness, they were similar to what has been seen in other reports. Severe obesity and chronic kidney disease were the 2 most prominent in this study. Now, notably, only 27% of the patients had a known exposure to COVID-19, which really speaks to the early, rapid, and silent spread within our community.
Exactly right. Frank, I want to ask you about one other study that reported preliminary results today, keyword there, preliminary, on using steroids to treat COVID-19.
Yeah, so this has been an ongoing study. It's called the Recovery Trial. It's being done in England, and it's looking at different therapies. So this was just one arm of the study. They reported in a press conference today that a low dose of the inexpensive steroid dexamethasone, also known as Decadron, reduced the risk of death in patients who were on a ventilator as well as patients who required oxygen. There are a couple of important things to note. First of all, this is a preliminary result. Nothing has been published or reviewed yet, and the use of steroids in general with COVID-19 has actually been the subject of some debate. There is other evidence that if used too early, steroids may increase infection. So the bottom line is, while this is very promising, the benefit may in fact be in the timing, and no one should take steroids on their own without discussing their situation with their doctor. And of course, there are more studies ongoing of dexamethasone.
Yeah, exactly right. And throughout this COVID crisis, of course, teachers have had to completely change what they do and how they do it. We've got more on that coming up as well, Kimberly.